that pets can get diabetes. Sometimes that requires insulin injections. So today we're going to show you how to appropriately fix up and draw up the correct amount of insulin and administer it to our clinic cat Daisy, who doesn't really need insulin, but we're using her for this purpose. There are two different types of insulin, basically U100 insulin or U40 insulin. It's very important to distinguish the difference because you're going to use a different type of syringe for each of those. I have two different types of syringes here. These syringes are marked for U40 insulin. Do not use this type with any other insulin besides U40 insulin. This one is for U100 insulin, and it states right there in tiny print. So you have to be very careful when you purchase syringes that you're getting the correct type. If you have a concern, please check with your veterinarian. Insulin needs to be kept in the refrigerator and should be mixed before you give it. This type of insulin, and most types of insulin, are made with microspheres inside. So you don't want to shake that bottle because you can break the microspheres and that will decrease the efficacy of the insulin. To mix the insulin, what you want to do is lay it in your hand and roll it fairly vigorously, but enough to mix it without shaking and damaging those microspheres. Then I'm going to take a syringe and draw up the appropriate amount of insulin for your pet. Each line is a unit on the syringe, so if you drop this much, that is 5 units. Now, we're really not going to give Daisy insulin. We're going to give her some sterile water instead. Here, I have 5 units of sterile water. And you're going to want to put your kitty on something kind of high so they feel a little bit intimidated. And pinch a little bit of the skin, make a tent, and put the needle in right underneath your thumb. You can aspirate to make sure that you don't have any blood in your syringe, and then do the injection. It's a good idea to spread the injection sites around so you can make a Z or an S-shaped pattern on their back whenever you give the insulin, so that one area of the skin doesn't become toughened. If that happens, the insulin does not get absorbed as well. And that's it. If you have any questions, please feel free to contact your veterinarian who can better answer questions about your specific pet.